Mercer's mission is very important to me, and that's one of the reasons that I wanted to apply here. Their mission of providing physicians in Georgia, specifically for the rural and medically underserved areas, is what I want to do with my life. So my name is Roxanna Gonzalez. I am from Woodstock, Georgia. I went to Oak Grove Elementary School, E.T. Booth Middle School, and I graduated from Etowah High School. I went to Kennesaw State in Kennesaw, Georgia for undergrad, where I majored in biology, and I am now studying at Mercer University School of Medicine to be a physician. I would tell students in my old school to not be afraid of rejection, to not be afraid to be told no, or for lack of better words, to sound dumb, because I know that people don't reach out to teachers or don't ask questions when they're confused, or don't create these relationships because they're afraid of rejection or being afraid of no. And the worst thing people can say to you is no. And they'll just say it and you'll move on and keep trying. Someone else will say yes eventually, and everything will work out. I knew I wanted to be a doctor when I was little, and my parents would always encourage me to be whatever I wanted to be. And then I had this experience with my grandmother who was diagnosed with cancer, and it wasn't a good experience with the physicians. And instead of taking it the bad way and thinking all physicians are bad, I decided to go the opposite side and think, I don't want other people to experience the same thing. So I want to be the good physician and make sure that other people don't have the same experiences my family did, at least. I don't know where I want to practice medicine. I know that I want to practice in a community that is medically underserved, preferably the Hispanic community, because I know that there's a need for that, and I know that I can serve that need. My number one choice at the moment is primary care, because primary care is really an overview of the whole patient. You get to treat them from childhood until, the end. And I feel like being able to make sure that they're being cared for in all aspects of their health is very important. So being a child of immigrants, I have the privilege of seeing the Hispanic population in two settings. So one being from the immigrant side and one being born here. So I see the struggles and barriers that my Hispanic family members or people in the community in general that they have when it comes to healthcare. So for instance, both financial, if they don't make enough money or they don't get employed by certain people, they can't get good healthcare, or language barriers. So if they can't understand their physician or their physician can't understand them, that definitely is going to dampen their healthcare. One of the things that I'm trying to do is teach medical Spanish and have like a medical Spanish course, because a lot of physicians, go out in the world and then they can't treat the patients in their population, because the Hispanic population, there's a lot of them in Georgia. There's like 1 million Hispanics in Georgia, and the physicians that are Latinos or that can speak Spanish fluently is not enough to cover that population. So I think that diversity in medicine is important, because all those patients that you need to see, if you don't have a diverse population of physicians, you can't treat all of them the way that they deserve to be treated. My mother is from Mexico, and my dad is from El Salvador. They came to this country when they were really young, or when they were young adults. They put a lot of effort into what they do every day, and I know that they do it to give me and my brother a better life. I want to make my whole community proud. They're all rooting for me. This dream to be a doctor is not only mine, it's a lot of people's dreams. When I go home, they're all like, oh, it's Dr. Roxy, she's gonna be a doctor one day. And I'm like, I'm gonna be a doctor for you guys.